So many patients ask, Doctor, how does IVF work? So first we will see what is IVF. Hello everyone, I am Dr. Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. IVF is in vitro fertilization, which means we are taking out the eggs outside the body and fertilizing them with the sperms outside the body, creating embryos, which are babies, and then transferring back those embryos into the uterus. Now let us see IVF step by step. So what are the steps of IVF? First step is initial evaluation of the couple, where both male and female partners are given some blood test, semen analysis, where both male and female partners are given blood test. Husband is asked to give semen analysis. Wife undergoes ultrasound, detailed ultrasound scan to know the problems with the uterus, ovaries, tubes, etc. Second step is starting of the stimulation. Stimulation means where we give injections to the lady to grow multiple eggs in the ovary. In a natural cycle, only one egg develops. But in IVF, we try to grow multiple eggs. So ovarian stimulation is the stage where we give injections to the lady every day for approximately 10 to 12 days. Once all the eggs have come to a particular size, we give trigger injection so that the eggs will undergo the process of maturation. Just before eggs are released, we take those eggs outside the body by a process called egg pickup. So egg pickup is done under anesthesia. It is similar way how we do your ultrasound scans by transvaginal route. There is a needle which goes next to the probe, which aspirates the fluid from the follicles in the ovary. Because the needle is entering into the body, we give anesthesia. After egg pickup, on the same day, the husband gives semen sample, and each mature egg is then injected with husband's sperm. So this is what we are doing, called ICSI, intracytoplasmic sperm injection. Once the eggs are injected with the sperm, next day embryologist will check fertilization in the lab. Fertilization means single cell egg now has become two cell, which means the babies have started forming in the lab. After fertilization, we observe the embryos in the lab for 5 to 6 days. The embryos which have continuously grown and developed on 5th day are called blastocyst embryos. These embryos are then either frozen or transferred back to the uterus. So once the embryos are frozen, patient is advised to follow up on next period, and we start preparing the lining of the uterus. Once the lining of the uterus is ready, which takes approximately 12 to 15 days, we put back the embryo into the uterus, which is called embryo transfer procedure. Usually, embryo transfer procedure does not require any anesthesia because it is not at all painful. So this is about IVF. Now let us see how IVF works. Why it works. So why IVF works? Because there are many steps in IVF which overcome certain factors. Like if there is tubal factor, if tubes are blocked, egg and sperm naturally cannot meet in the body. In IVF, we don't need the tubes to be open. We can just take out the eggs, combine with the sperm, prepare embryos and put back. So the only function of the tubes in the body is allowing the egg and sperm to meet. So it overcomes tubal factor. Sometimes tubes may be open, but they may not be functional. So in such cases also, IVF works because we are creating the embryos. In other cases, it overcomes cervical factor. It overcomes male factor, where the sperm motility and count is on the lower side, where the sperms on their own cannot travel through the uterus and reach the tube for fertilization of the eggs. So all these factors are overcome in IVF. Also, what we do in IVF is we develop multiple eggs, whereas in natural cycle, there is only one egg which grows. So with the multiple eggs, we have a chance to create multiple embryos or babies. So out of those embryos, we can select the best one to transfer. Whereas in a natural cycle, only one egg develops and there is a chance of the same egg being fertilized. Hence, when the number is more, the chances will increase in IVF. So this is how IVF works. So what does IVF specialist do? IVF specialist or fertility specialist evaluate the couple properly and individualize the treatment. IVF cannot be same for each and every person. Everybody's body is different, health issues are different, and it's not like maths. So that we have to see the entire picture and see what are the best chances, which protocols to use, which drugs will help, when to plan the transfer. Also, if any surgery is required in between the embryo transfer and egg pickup. Another advantage of IVF is we can actually separate the process of embryo formation. Once we freeze the embryos, we can take our time to correct other factors in the uterus like fibroids in the wall, adenomyosis, endometrial polyp, or hydrosalpinx. Some of these factors may require medications, some may require surgical correction. In natural cycle, what happens is because embryos formed in the same cycle, if there are other factors like polyp, adenomyosis, fibroids, or hydrosalpinx, they will affect the implantation and pregnancy may not happen. But in IVF, we can freeze the embryos, and after embryos are formed, we can take care of these factors like fibroid can be removed operatively, or adenomyosis can be given injection to shrink its size, or hydrosalpinx can be taken care of before embryo transfer, hence increasing the chances of pregnancy. What is patient expected to do? To select a proper fertility center with good facilities, with proven success rate, experienced and skilled doctor, and whatever the medications have been given or the timeline has been given by the fertility specialist, to follow the timeline, including the medications and timing of medications. So this is about how IVF works. I hope this was helpful.